Hello, welcome to Dr. Chen's Minor Ailments Forum. I haven't done any videos for quite a while because work has been quite hectic recently, but I thought today I might spend some time on talking about diabetes and in particular how we diagnose diabetes and what is good control, because I from day-to-day consultation I realized that my patients who are diabetic don't really know how we measure whether their diabetes control is good, and they do know that we do a blood test every 3 months to 6 months, but they don't know how to interpret it. So I always have a strong belief in, if you're diabetic, you need to know how we measure the control, and also how to kind of improve the control. So I thought I would spend some time on that today. So basically, let's start off with the blood test that we do. So every 3 months or 6 months, depends on how well your control is, we do a hba1c blood test. Okay, so this test is looking for how the blood sugar has been in the past 3 months. So if you're a diabetic, you might occasionally check your blood sugar by finger prick, and what that actually show you is the control at that moment in time. So let's just say if I've been eating a burger before and I go and check my blood sugar now, it will automatically shoot up if I'm a diabetic, and so you can see that this number is only transient and it's only reflecting at that moment in time how well your blood sugar is controlled. So, but the way that we do it is to look back to the past 3 months, and the interesting thing about this blood test is that if you, let's say I take the blood test today, it's not only reflecting at the moment in time, but it's also showing me how well you've done in the past 3 months, kind of like a computer storing the information. So I would, well, normally I'll ask my patient, do you know what is a good control, what that number should be for the hba1c? And most people have no idea, actually. And I think that, as doctors, we need to spend a little bit more time explaining to the patients what is good control, so they know what to aim for. So in the old money, generally speaking, we're aiming for a blood sugar of 6.3 to around 7.2, then that would be relatively good control for us. Okay, but obviously the hba1c is now read in a new money, so the numbers that we're looking for are double digits. So equivalent of 6.3 would be 45 and 7.2 will be 55. So let's recap. So the hba1c for the patient who's diabetic, good control should be between 45 to 55. So you might say, well, what's the importance of these numbers anyway? It doesn't mean anything to me, it's just numbers. Well, that's the interesting thing about it, because how we monitor the patients with diabetes all depends on the hba1c results. So if, let's just say, when we check your blood ever so often, you're always hitting within range, like between 45 and 55, I can say that your diabetes is very well controlled, and the medication that you're taking, or maybe the diet that you're doing, is clearly doing the job. But if, let's just say, if we're doing a 3 to 6 monthly blood test and it's actually showing an incline of this hba1c number, that's kind of telling me that maybe, number one, lifestyle need to change in order to improve the number, or maybe actually you need more medications, because diabetes, a progressive disease, is not something that will stay the same every year. It's all depending on the person, depends on the lifestyle, and also family history and other comorbidities, for example, whether you've got high blood pressure or heart disease, etc. So I think this is very important for us to keep an eye on the hba1c. So next time when you go and see your GP, and if you're diabetic, by all means ask them, when was my last hba1c done? So in conclusion, I would say that the hba1c is very important for all diabetic patients to have at least once a year. And for those who are having poorly controlled diabetes, probably might need to have it every 3 to 6 months, depending on the progress. If you have further questions, I would advise you to go and seek the advice from your GP. And if you stay in tune, I would have more videos coming up talking about how diabetes actually present and how we diagnose it. Okay, take care for now. Thank you. Bye-bye.